Erythroblastosis fetalis, a life-threatening blood disorder, can lead to severe complications in newborns. This grim reality is one we cannot ignore, as it poses a significant risk to the health and survival of infants. Erythroblastosis fetalis is a hemolytic disorder that primarily affects fetuses and neonates. At its core, it's a tale of incompatibility, specifically RHD, incompatibility between the mother and her developing fetus. Imagine the human body as a complex, well-orchestrated symphony. When all elements are in harmony, it creates a beautiful melody. But when one element is out of sync, it can disrupt the entire performance. This is what happens in erythroblastosis fetalis. The mother's body perceives the Rh-positive red blood cells of the fetus as foreign elements and responds by producing Rh antibodies. These antibodies, in turn, attack the fetus's red blood cells, leading to their destruction and causing hemolytic anemia in the fetus. The severity of this disorder varies. The first pregnancy may witness a mild manifestation of this incompatibility, sparing the fetus and newborn any serious harm. But the plot thickens with the second pregnancy. If Rh incompatibility persists, the developing infant faces a higher risk of severe erythroblastosis, which translates to extensive destruction of red blood cells. Erythroblastosis fetalis is not limited to Rh incompatibility. It can also arise from ABO, KEL, KID, Duffy incompatibilities, and other blood antigen mismatches. This disorder, if left unchecked, can lead to fatal consequences. The primary cause of erythroblastosis fetalis revolves around an incompatibility in the Rh blood group system. Imagine two countries with different languages. Now think of the Rh blood group system as a language of the body. In a typical pregnancy, the mother and the developing fetus share the same language, or Rh factor, but sometimes they don't. The mother might be R negative, while the fetus is R positive. So, what happens when there's a language barrier, confusion and conflict? In our scenario, the mother's body perceives the Rh-positive red blood cells of the fetus as foreign invaders. It's like a stranger wandering into a country without speaking the local language. Now, the mother's immune system is a bit of a patriot. It doesn't take kindly to these foreign cells. It sees them as a threat and starts producing Rh antibodies. These antibodies are like soldiers designed to protect the mother's body from what it perceives as an invasion. Once these soldiers are in place, they wage war on the fetus's red blood cells. They attack and destroy them, causing a condition called hemolytic anemia in the fetus. It's like a battle happening right inside the womb at the cellular level. In most cases, the first pregnancy doesn't result in severe harm to the fetus or newborn. It's like the mother's body is caught off guard, and it takes time to muster its forces. But by the time of the second pregnancy, the mother's immune system is ready. If the second fetus is also Rh positive, the antibodies are already in place and ready to attack. Erythroblastosis fetalis isn't always about Rh incompatibility. It can also occur due to ABO incompatibility, KEL incompatibility, KID incompatibility, Duffy incompatibility, and other blood antigen incompatibilities. These are like different dialects within the language of the body, adding another layer of complexity to the situation. Rh incompatibility is a silent battle fought at the cellular level that can have devastating effects on the developing fetus. Fortunately, erythroblastosis fetalis can be diagnosed and prevented. Diagnosing this condition is crucial in mitigating its adverse effects, and it involves several steps. Firstly, maternal blood typing and antibody screening form the cornerstone of the diagnostic process. By identifying the mother's blood type and checking for the presence of Rh antibodies, we can assess the risk of Rh incompatibility. Next, we measure the antibody levels in the pregnant mother's blood. An elevated level of antibodies indicates a higher risk of erythroblastosis fetalis. Cell-free fetal DNA screening is another innovative technique used. This non-invasive prenatal test allows us to analyze the baby's DNA in the mother's blood, providing further insights into the risk of Rh incompatibility. Other diagnostic measures include ultrasound of the fetus, tests of amniotic fluid, fetal middle cerebral blood flow measurement, and fetal umbilical cord blood testing. These procedures provide us with a comprehensive overview of the baby's health and the potential presence of Erythroblastosis Fetalis. Once the baby is born, we perform additional tests such as a red blood cell count and a bilirubin test. We also study the presence of antibodies and the Rh factor in the infant. But what about prevention? How can we stop this condition before it even starts? Here's where Rh immunoglobulin, also known as RIG or ROGAM, comes into play. This medication is a game changer. Administered to Rh-negative mothers, it prevents the development of Rh antibodies in the mother's body. In other words, it stops the mother's immune system from attacking the baby's red blood cells. This preemptive strike is crucial because it significantly reduces the risk of erythroblastosis fetalis in both current and future pregnancies. So while erythroblastosis fetalis is indeed a grave condition, it's not unbeatable. With the right diagnostic measures and preventative medication, we can keep both mother and baby safe. Early diagnosis and prevention can turn the tide in the battle against erythroblastosis fetalis. While erythroblastosis fetalis is a severe disorder, it is not without hope. When it comes to treatment, there are several options available to manage and alleviate the symptoms of this condition. The first line of treatment often involves a procedure called fetal blood transfusion. This is a medical procedure in which the unhealthy blood of the fetus is replaced with healthy blood. This can help to counteract the effects of the disorder and provide the fetus with a fresh supply of healthy red blood cells. Another common treatment option is hydration of the infant with intravenous fluids. This can help to manage the symptoms of anemia and ensure that the infant's body has the necessary hydration to function properly. This is particularly important as anemia can often lead to dehydration, so maintaining fluid levels is crucial. Intravenous immunoglobulin, or IVG, is another treatment option that can be utilized. This is a type of therapy that involves the administration of antibodies to help the body fight off the destructive effects of the disorder. This can help to prevent further damage to the red blood cells and promote healthier blood flow. The choice of treatment is typically determined by the severity of the condition and the overall health of the fetus or newborn. It's important to remember that each case is unique and the treatment plan will be tailored to meet the individual needs of the patient. With the right treatment, a child suffering from erythroblastosis fetalis can lead a healthy life.